All right, welcome everybody. My name is Neeti. I am the functional medicine nutritionist and founder of Back to Basics Functional Nutrition. I am super thrilled today because with me, I have a special guest who has 26 years of clinical experience under her belt and is a board certified family physician and who is here to bust some myths regarding osteoporosis. We all would have come across this term osteoporosis or would have known of a loved one who is suffering with osteoporosis, as in it's common, it's debilitating, and at times is considered just natural part of aging, right? But does it have to be? So, without further ado, let me welcome Dr. Penney Stringer, who has her private practice in beautiful Richland, Washington, where she helps women get to the root cause and treat them for their hormonal and digestive health. Welcome, Dr. Stringer.
Thank you so much, Neeti, for having me.
Absolutely, it's my pleasure. And so, before we begin and you bust some osteoporosis myths, why don't you tell our listeners why you do what you do?
Okay, so yeah, I'm just super committed to and passionate about helping women and men to live their best lives in body, mind, and spirit. And for me, that means being able to move these bodies, being able to think really well until our really old age, and being able to boogie in these bodies until we die. And osteoporosis is kind of at the crossroads of helping people to be able to do that if they can prevent it and if they can keep healthy muscles and healthy bones their lifetime, then they'll be able to do things that they love and have a very fulfilling life.
Beautiful, beautiful. I'm so glad you're doing that, doctor. And so, for the longest time, we all know I did that when I was I have young kids who are now young adults. But I remember when they were growing up, I would be like, "Yo, you need to get your glass of milk." And so we all of us would have come across some part of in their lives where we associate milk with bone health, and we feel that that calcium bank is going to help all of us, and yay, we will not have osteoporosis in later part of life. Why don't you throw light as to why do you think if this is true, then yes, why, and if not, then what is the truth?
Yeah, so milk and dairy are a little bit complicated in that the proteins in milk are really meant for baby cows. Humans have been able to adapt and consume milk, but really in the big scheme of things, it's not the best way to get calcium in our diets. A lot of the patients that come to functional medicine, physicians like myself and nutritionists like yourself, already have inflammatory issues. And what we find is that the dairy proteins are contributing to some of that inflammation, especially on the gut level, making it harder to absorb calcium and other minerals and to break down proteins and get the nutrients from your foods. So there are a bunch of foods that actually have more calcium than a glass of milk. And I would love to see marketing strategies around those kind of foods. I'm happy to name some of those because we've all seen the billboards, got milk, and we just think that that's what you're supposed to drink and that's what you're supposed to give your kids. But really, it's based on the marketing of milk of the dairy farmers, and so really, there's other foods that have just as much calcium. And truthfully, we're supposed to get most of our calcium from the foods that we eat, not from supplements. So just for example, chia seeds, you might know about chia seeds. They're inexpensive little seeds, they're little black seeds. And 3 tablespoons of chia seeds has more calcium than a glass of milk. Plus, it has all kinds of other nutrients like omega-3s and good fiber and things like that. So chia, salmon, sardines, almonds, green leafy vegetables, chickpeas, tofu, even any oatmeal. Those are all really good sources of calcium that I promote people eating those over dairy, if at all possible. If they don't know their dairy status, if dairy might be inflammatory to them, which could further worsen an osteoporotic condition, which is also based on inflammation.
Yes. Wonderful.
Mm.
Yes. I tell my clients, just like you said, Penny, that milk is actually a convenient source of calcium. Yes, it is absolutely a source of calcium, but how the things have changed, how the processing has changed, it has become inflammatory. And there are other beautiful sources, like you mentioned, chia seeds, green leafy vegetables, salmon, sardines, so many to tap into, right? So I'm glad you shared that. And we can definitely let you know if you come work with us. Like there is a beautiful handout that even IFM has shared where like there are non-dairy sources of calcium and that you can tap into. So yes, absolutely, tap into those and get the benefits.
And interestingly, the cows get their calcium from the grass. They eat the green leafy grass, right? So
Right. Exactly. Yeah. So there is more in store for that.
Mhm, mhm.
Absolutely. And so most of the people should get, like you said, their calcium from their foods. But in old age, if they were to supplement calcium, how what salt of calcium do you recommend, and what is the max in milligrams? Because does more calcium mean better bone health?
Mhm. Not necessarily. So it's really recommended to not get more than 500 milligrams of calcium from
Mhm.
supplements, the rest from
Mhm.
foods. As we age, we need upwards of 1,200 to 1,500 milligrams a day. So, better, there's differently absorbed forms of calcium,
Right.
calcium citrate, calcium carbonate, different.
Mhm.
Calcium carbonate's not as well absorbed as like more like calcium citrate and some of the other forms. So it's good to look at the ingredients on a supplement, and also you want to have it balanced with magnesium, vitamin D, vitamin K. And vitamin K is really interesting because we can get it from green leafy vegetables. We can also get it from eating fermented foods, but more importantly, our gut is fermenting things, and it's through that fermentation process from the bacteria in our gut that we make vitamin K2. And vitamin K2 helps so that the calcium that we're eating and taking in doesn't land in our arteries. It actually lands in our bones and teeth. So it's really important to have that balance of the fat-soluble vitamins of vitamin D and vitamin K. So once again, it comes back to a healthy gut. A healthy gut with a
Mhm.
variety of lots of nutrients and fibers and colorful fruits and vegetables promotes these good bacteria that promote these good vitamins
Mhm.
also promote more minerals in your being absorbed that helps you form bone and helps prevent inflammation. So it's like all comes back to lifestyle, diet, and lifestyle.
Right, absolutely. And you and me, we are used to this diet and lifestyle cycle, but not everyone would be aware because. And can you throw a light on what are the less common causes or less not commonly known causes of osteoporosis?
Yeah, so there's definitely genetic components, but more than that, the lifestyle will turn on and off these genes. So different things like even medications people might not think about. So like
Mhm.
the use of antacids, the use of the proton pump inhibitors like Prilosec and omeprazole, things like that, will block absorption of some of these minerals. The
Right.
use of steroids, even like inhaled steroids, can predispose you to osteoporosis. High stressful lifestyle because cortisol will cause breakdown of bone. If you drink sodas, those will leach calcium out of your bones. Um, Sedentary lifestyle, alcoholism, any of the autoimmune diseases, especially Crohn's, ulcerative colitis, rheumatoid arthritis, celiac is a really big risk for osteoporosis, which is
Ooh,
the autoimmune sensitivity to gluten, the protein
right.
in rye and barley. And then also as we age, one of the things that happens after menopause for women, but even before that, is we start to lose muscle mass and bone. Our bone strength follows our muscle strength. So,
Mhm.
and then that rapid decline in hormones around those 10 years around menopause, as menopause hits in the next 10 years, there's a really rapid increase in osteoporosis or the breakdown of bones. So hormonal changes have a big impact on bone as well, and anything to do with inflammation. So anything to do with infections or poor oral health, poor gut health, um, all of those can be risk factors for osteoporosis.
Wow, wow. So would you say that if someone takes care of their muscle strength, they would have better bone health?
Definitely. Yep, definitely. So that's one of the treatments is making sure you stay active, exercise, you know, weight training, using bands, doing squats.
Right.
Even there's 8 poses in yoga that have been shown to reduce osteoporosis over a 2-year period that have been studied at Columbia, um, that I can make available to your listeners.
Yes, absolutely. Yes, please send me over, and I'll be happy to put it in the comment section so that way people can take a look at the statistics. Awesome. That would be awesome.
That's great. And there's one other thing I think that's really important is that there's some pretty dismal statistics, but this one that I think is really telling is um, the risk after an osteoporotic hip fracture. The mortality rate in the first year after osteoporotic hip fracture is upwards of 20 to 25%,
Ooh.
meaning after a hip fracture, people don't just like get more debilitated; they actually die. And so that rate of mortality is higher than a lot of cancers and even heart disease. So it just kind of points to me the importance of really thinking of this as like a public health issue, and really trying to address the cause, because as we know, the medications that have been developed for osteoporosis really don't help. They really don't do much. They might show that there's denser bone on the X-ray, but it doesn't look like it's healthier bone. In fact, the fractures that occur on medications are often worse kind of fractures than people that didn't have the medications.
Really? Wow. Yeah, and there are always a new class of medications that are coming through, and at times people feel like that is their only hope, and that's why they stick to those medications. But like you mentioned, that they don't really help in the long run. At times, they might even hurt. But if that is not going to help, because that's what people are looking for, Dr. Stringer, what is the other options they have? Or we talked about eating calcium rich foods, getting some amount of calcium supplementation, resisted exercises. What are the other things that they should have as a part of their diet and lifestyle, such that it should not come? And if it is there, is there hope that it can be reversed?
Yeah, definitely. So like definitely limiting alcohol, limiting sugary foods,
Mhm.
sodas. Also, if you're interested and you're a candidate, considering hormone replacement therapy as a woman in her perimenopausal, menopausal years, because as we know, estrogen and testosterone are some of the 2 substances known that can actually increase the remodeling of bone. So
Really?
if you're a candidate, that's a really good option, and a good reason to consider hormone replacement therapy is for bone remodeling. Also to reduce stress, because high cortisol will break down bone, and to stay active. And also the other thing, which I think is so important, is balance. So we lose our balance as we age, and so really intentionally um, focusing on balance and doing balance exercises, even when you're standing at your counter, doing dishes or cleaning up. You go into tree pose, where you put one foot on your leg and try to just stand on one foot, and then maybe just, if you're not quite there, just lift up one foot and just kind of practice that while you're putting your clothes on. And as you do that, those pathways will get formed. Those neuronal pathways will get formed.
Oh wow, beautiful, beautiful. So many wonderful tips. So it's not just we just Dr. Stringer just gave. It can be managing your lifestyle, managing that stress, cutting out that sugary foods, cutting out that alcohol, right? Right, which might not be necessary every single time, and hormone replacement therapy for bone remodeling. And beautiful last but not the least that you mentioned is balance exercises, which we always think of osteoporosis and we think of resisted exercises or strengthening exercises, but yeah, balance exercises can take your health to the next level.
Mhm. Yes, well summarized.
Awesome. Thank you, Dr. Stringer. And before we end, is there any any myth that comes to your mind that you see on a day-to-day basis that you see with your patients, and you'll be like, ooh, why are they doing this?
Yeah, and there's actually we probably don't have time to go into it too much, but there's some exercises that wouldn't be so good. Like if you know you already have some osteoporosis, there's certain forward bending, spinal bending exercises that may not be the best on the spine. But for the most part, I think if you can find an exercise you'd like to do, like even if it's dancing after dinner, or going for a walk, or even using a little weighted vest that has if you have thin bones. Putting a little weight in a vest. They have them, you can get them online. That just a little extra weight to give the signal to your bones to like reform can be helpful. But I think doing what's enjoyable to you is really important.
Is the key.
Doing every day if you can.
Exactly. Only then can you stick to it.
Right. Exactly.
Awesome. And is there any other myth that you have come across, doctor, or some key takeaway that you want to leave our listeners with?
Yeah, so I think the key is it comes back down to lifestyle. Oh, and the other thing is vitamin D. So, you might go to your doctor and get your vitamin D checked, but the range for normal it starts at 30 and goes up to I think 50 or 60. But really, for preventing osteoporosis, you want your levels to be around 50 to 80. So I would encourage everyone to get a check for vitamin D, but also to get a baseline DEXA scan around age 35 to 40. And then there's one key point I just want to make this too, is that there's also an FDA-approved test that not a lot of doctors are talking about, but it's approved for assessing for bone loss. Okay. And so some people will get the DEXA scan, which is the X-ray to test your bone density, but most insurances won't cover another test for 2 years. So if you make a dietary intervention, or you clean up your gut, or you stop alcohol, or you start exercising, you won't know if that's helping your bones for 2 years. That's too long to wait. Right. There's this other test called the N-telepeptide. It's a urine test. Okay. And it can show if there's active bone loss. And I find it very helpful for when we're making lifestyle interventions to then 6 months later be able to do this test and see if the bone loss has slowed down.
Oh, beautiful. And is that test commonly available at Quest or LabCorp?
Yeah, at all the regular labs.
All the regular. Okay, beautiful. And you said it's N-telepeptide.
N-telepeptide, and it's a urine test.
Urine test. Beautiful. Wonderful. So yeah, get out there, do your balance exercises, and eat those calcium-rich foods, chia seeds, and get healthy. And we would put the links to the studies and the test in the comment section below, and get healthy. And thank you so much, Dr. Penney, for sharing all that wisdom with all our listeners.
You're so welcome. We'll meet you on the mountain.
Awesome.